And this is actually our second press conference for today. In the past few days, our friends from the media and also citizens in Qingdao actually worked really hard days and nights. This sudden outbreak in Qingdao has a certain impact to our normal life and work. After the outbreak, based on DA guidance and arrangement made by DA central government and local government, has established the working mechanism in disease prevention and control. And the vice governor led the whole team. And yesterday afternoon, a party secretary and also the governor and also mayor of Qingdao also paid a visit on site and also asked us to do a good job in treating patients, conducting epidemiological investigation, screening out the potential cases, testing and risk measurement in a swift and a detailed and solid manner in order to win the battle against COVID-19. As of 6 p.m. today, we have collected 8,800,000 samples so far. As of 6 p.m., we have got 5.41 million samples already got the results. Besides the 12 confirmed cases are already reported to the public, so far no new cases have been found. As of 6 o'clock p.m. today, we have screened the close contacts totaling 532. They all received the centralized quarantine and also finished first 2 rounds of NAT. For the third round, we already collected all the samples. In our first round, we found that 9 positive NAT and released to the public immediately, and for the rest, all negative. We selected the samples for the third round of NAT of all these close contacts. So far, no positive cases were found. For general contact, 859 people all finished NAT, and they also conducted 2 times, and the results all showed negative. So what I would like to highlight here, the medical personnel, the in-hospital patients and the caretakers, totaling 206,000 people, they all finished the sample collecting of NAT. Also including all the medics in the city of Qingdao, but that including close contacts and close contacts of close contacts in the chest hospitals. So the medical personnel in hospital patients and the caretakers were taken NAT samples. So after we established the interagency mechanism, so we practice everything in line with the 7th edition of disease prevention and control and treatment. So anyone paid a visit to the fever clinic, or they need to be hospitalized, or should be act as a caretakers in the hospital, they should be all tested. So we talk about that 206,193 actually including all these group of people, namely medical personnel, in-hospital patients, and caretakers. All their results actually were negative. As of 6 p.m. today, we have finished a sweeping NAT in the city of Qingdao. So that's basically to take NAT samples of the people in Qingdao. So that's the community level, totaling 8 million. So among that 8.61 million samples, the 5.20 million already show the results and all negative. So I would highlight two things. First, that's the around 200,000 medical people, the patients in the hospital, caretakers, and the citizens in Qingdao, totaling 8.6 million, all finished sample selections. So based on the requirement of interagency working mechanism and also the relevant regulations made by the central level and local level, so the key city areas, so we talk about that the 5 key areas, so the south, north, Lichang, Laoshan, and Chengyang, these 5 areas, that they should finish the citywide NAT covering all citizens in 3 days. So this is actually based on the numbers provided by the public security. So in totaling, that should be 4.15 million people in these 5 areas. As of 6 p.m. today, $3.41 million people have been taken the NAT. 85% of the total population in these 5 areas all show negative results. Because right now this is actually the numbers. They upload the results online in any time. So our focus as of 9 p.m. today, for these 5 regions, we'll finish 93% of the total population. As of 10 p.m., we'll finish 97% of the total target. So as of the 24 o'clock today, we will finish the NAT testing in these 5 regions, which means that they will show the final results of all these samples selected. So we talk about the residents in these 5 regions. We still have some tail work to finish. So the majority of the residents in these 5 areas that should be finished today. So we can tell that actually this afternoon at the testing station, we have not seen that long queue compared to the previous days. Our medical practitioners and also the volunteers helped to conduct the testing door to door, make sure no one left behind. So the government actually made this decision, and we actually invested headcount, capitals, and efforts to make sure that everyone should be included and tested. which also demonstrate that we always take people as our top priority. We should do this in a good manner. But we still need to do some finishing work, which means that the people that may not available in these 3 days, it also can be tested. But we're talking about that the majority work is going to be done and concluded in these 3 days. So we talk about the 6 million testing in 3 days for these 5 areas. It may some misunderstanding surrounding online. So we talk about the measures we have taken. Actually, it's guided by the central government, local government, and also the expert team. So based on the epidemiological investigation, and the professional testing models, actually we made this decision to target at 4 million residents in these 5 areas. For the remaining 2 days, we should realize the 10 areas in Qingdao, including 1.1 million people, should be all collected their NAT samples. So every afternoon, 4 p.m., we have our work conference. The Vice Governor and also Director, Vice Director of the Municipal Health Commission, and also people from the Public Security Department, and also the officials from Qingdao government. So we have actually, besides our vice mayor and the 2 mayors and our mayor, 3 vice mayors, and also the 5 standing committee members will take the leading position. We have different roles and responsibilities because right now we divided into 9 different teams. Yesterday, the party secretary of Qingdao has pointed out that we should mobilize all available resources in Shandong province to win the battle against coronavirus. The faster progress made in the sweeping test in Qingdao, we should give credit to the citizens in Qingdao, and also we should give a big thank you to our friends from the media. And we're also actually encouraged by a lot of the positive messages online. And also today, actually, I saw a video clip online from Portland, actually speaking Chinese. And she said in a very short time about conduct this large-scale NAT. And you look at the citizens actually really cooperative, so which is really touching. So yesterday, I also mentioned this in our regular meetings, that because our strong people are really helping hands from our media friends, we'll for sure win this battle. So we talk about the purchase of the supplies, the selecting of the samples. We mobilize the personnel, the party members in different communities, actually, they play a leading role. Every day, actually, at our video conference, we ask the leaders of each region should be the person at the forefront. And they also need to establish the team at each district. So for the very first day, actually, the outbreak caught us as a surprise. But in the afternoon, we already laid out a detailed requirement. And also the Health Commission developed an app. So when they upload the information from these 10 areas or 10 districts, the numbers are automatically transferred to a table in the Excel. So we also send out the team to monitor the work, make sure that everything actually practiced to its letters. Actually, we can learn some lessons from other cities and also some good practice we also can refer to. So we also actually contact the cities with experience before. So actually they give us a great help, and actually we learned a lot from them. So with these 3 days, you can say that our work actually have been carried out in a well-organized manner. But we talk about everything finally should be practiced. We should rely on our people and residents. So we will do everything we can to make sure that sweeping NAT sample collection can be finished as scheduled. So this is the 3rd day for sample selection among the 5 regions, and also a very crucial day. Make sure that no one unattended. So it was raining day today, but you look at the people actually working at the different sample selection stations. Different people take their roles and responsibilities, and volunteers, medical personnel, and also the security people actually make sure they provide the guidance work and also the safeguard work. And they also paid a visit door to door, especially to take samples to the home of the disabled or the elderly people. And also we work with Jinan, Zibo, Weifang, Rizhao, Weihai, Linyi, Hezhe, Binzhou, Jining, Dengying, or neighboring cities in Shandong province. And they also help us to do the NAT. And also we received more than 200 people with 7 teams. For NAT, they bring the 28 sets of NAT equipment. So we talk about actually we have also received more than 1,000 helping hand for NAT, but people still asking why we need to wait this long to get the final results. There are a lot of requirements that we need to do the comparison, transformation. It takes time. Actually, normally it takes 3 hours when the samples actually rolling on the machine, and also when the rolling work finished. Also need some time to upload the information. Going forward, we will continue to strictly practice the arrangement made by the CPC Central Committee and State Council as well as the local government. Make sure we always put people's health and safety as our top priority. We should pay responsibility to our people and also to do a good job in disease prevention and control in a swift and a solid manner. Make sure all these measures can be practiced in order to win this battle against coronavirus. I also would like to stay committed to the following things. First, we will spare no efforts to treat our patients. The infections happened in the test hospital. Actually, this is separate from the designated hospital. Although these two hospitals actually share the same campus, but they are totally separated areas. So we talk about the previous confirmed cases, the confirmed patients all received the treatment here. And right now, the imported cases, suspected cases, and confirmed cases all be treated here as well. So no infections happened in these hospitals. Having said that, because this is still an infectious disease hospital, so we talk about there are patients with TB. That is also one of the infectious disease. We talk about TB, actually also the immune system disease that will also impact the lungs. But actually also the coronavirus also target the lungs. So the coronavirus plus TB actually bring additional difficulties for treatment. But actually, thanks to the central government, they sent the expert team to Qingdao to treat our patients. So the rumor online saying that academician Zhong Nanshan already in Qingdao, actually that's a fake news. But we still have one well-known experts from different departments arrived in Qingdao. So we have the critical cases. One patient actually with underlying diseases, and one actually is elderly people in his 80s. So actually, we had some difficulties in treating our patients. We also actually had a big pressure. Based on the A4 centralization requirement, so we gave the A1 customized treating plan, the dedicated expert team to treat each patient. By doing so, we will do everything we can to treat and save the life of each patient, especially for the critical cases. Second, we will double our efforts to conduct NAT. We still have 2 days left, so we will do our utmost efforts to take NAT of all the residents. And besides the 5 areas, we will also dispatch the resources to other areas, make sure that we can finish the work in a quality and timely manner. So 1.1 million population, you should collect the NAT samples. And we when we have the final result of all these 1.1 million results, I believe that will set assure everyone. And also third, we also need to do a good job in the epidemiological investigation. So where is the source of this transmission? Who passed this infection to Qingdao, or how that transmitted in Qingdao? So the Central National Health Commission sent the expert team to Qingdao. So every day we studied the situation carefully. So everyone actually worked around the clock. Actually, the party secretary of Qingdao government actually asked us not to read the written messages. I'm saying that actually I haven't slept for 4 days, so it's a little bit hard for me, but actually I will try my best. But some numbers that should be really accurate, so I read the numbers out. So we will do a careful work to find out the source of transmission. So it's take time. Everyone put their close eye on this area. So we should be patient and give us some time. So we finished the sweeping NAT, and second, you know the source, you know where it came from. I believe not long. We do not need to wait really long, and that we will finally get that result. So right now we can say one thing really sure is that all the cases actually related to that chest hospital. So this is crystal clear. Fourth, we'll double our efforts to do the disease prevention and control work for the fall and winter seasons. Starting from today, for all the medical institutions, fever clinics, and also the hospitals at community, we'll also conduct the inspection work. We have the checklist for our inspection. Once we found the problems, we'll give them the punishment and also ask them to correct. And we'll also look at the prevention measures taken by the communities and also the villages, and also for the markets, for the large the entertainment places, and also supermarkets. They should also do a good job in disinfection. It's not saying that we're back to the situation in January or February. Talk about Lushanhou community. This community actually is the nearest compound to that chest hospital. So we also practice the disease prevention and control measures in a normalized fashion. So we talk about the clustered outbreak happened in Beijing, and then in Urumqi, Dalian, and Shenzhen. Actually, they all conducted more or less the same measures. So besides that area, other places in Qingdao all in low risk level. For the transportation, storage, and circulation of the daily necessities that should be also in our management, and that make sure that we focus on the both sides in terms of our daily life and also disease prevention and control work. We talk about the 2 wolf workers, and also this time we talk about 1 in-hospital patient in the chest hospital. They celebrated the holidays back home, and on October 10th, and he received another NAT in the nearby places because that person need to be hospitalized, so that person need to have an NAT certificate. So we locked that person. And also for the taxi drivers, he talk about actually he hospitalized for the cerebral infarction, and actually he need to be tested for NAT, and actually his wife was the caretaker in the chest hospital. So if we practice in line with the requirements made by the interagency mechanism, we will for sure find out all these cases. And also we call on every citizen to practice personal protection, such as wearing masks, less gatherings, and keeping your hand hygiene. We talk about disease prevention and control actually should be normalized, which means that should not be the showstopper to our daily life. We work united, and we have every reason to believe that as long as we work with all citizens in Qingdao, we will for sure win the battle. Thank you. Thank you, Westmere Xue, for the updated information. Now the floor is open. Please identify your media affiliation before asking questions. Now, please. Thank you. China Commerce newspaper. For this large scale of NAT, that for the household, the app can show the results of the NAT. How long does it take? Thank you. For your question, a very professional one. And after everyone be tested, it is understandable that actually people saying that it's better, no news is good news. So no one contacted is a good result. And for the NAT certificate or reports, if people need to conduct a business trip, and they can get that report online. And for the technical issues right now, we are undergoing the improvement. And I believe Mr. Zhao can give you more detailed answers. For the searching the system, actually is work like this. After a sample selected, then the agency help to upload to the backstage, the operation stage of the health commission, which also linked to the health code. So we talk about actually in the app of a health code, you can click the button of showing the results of NAT. If you click it, actually can show you the results. But actually, at the current stage, we right now are conducting a sweeping NAT. The number of the samples actually above 1 million every day. So that's a big samples in the pipeline waiting for to be tested. So we have a big pressure and also have some difficulties. If you click the button, that it show you that you need to wait for 2 to 3 days to wait for the final results. So please be patient and also give us some time, as Mr. Xu introduced already. So if tested positive, then the agency, someone will contact you for sure. If no one from CDC contacted you, which means you are safe, which means that you are negative to the virus. So we are also accelerate our working progress and make sure that people can get the results of NAT ASAP. So let's say the information actually is in dynamic condition. So we talk about that if no one contacts you within 24 hours of your sample selected, then you are free. Let's say if someone from CDC contacts you in a very short time, then which means you actually positive to the virus. And also we discourage people to conduct unnecessary outings. And we also ask our officials to help for uploading the informations, because still it's a really vast number of samples. But the thing is, like, we should let everyone understand how the thing works. Thank you very much. With the Qingdao Daily, Loshanhou community actually confirmed as a middle risk level. So the buses, if they stopped over the Loshanhou community, how the people can be protected if they travel by Loshanhou area. The day when we announced that Loshanhou as middle level risk region, we actually, with the experts, visited at places. Actually, me myself also encountered the same issue as you mentioned. So the color of your household should be changed or not? Need to be conduct disinfections? I believe that's the question to everyone. We talk about people in quarantine. Of course, the color of their households should be changed, no matter it's the close contacts or confirmed cases or close contacts of close contacts, or people in this community. The color of their household, the household for sure changed. As you mentioned, for the buses, I believe that Mr. Chen Wensheng to give you the answer. Actually, we also received the questions raised by the public, saying that if actually I need to go out to work and also the buses stop over the Lushanhou area. So for the buses, actually, it's like when they finish the first round of service, they should conduct disinfections and ventilation, and also they need to conduct ventilation during the service period. And also on all the buses, we also have the notice that ask people, passengers, to show the health code, and also they should wear masks throughout the whole journey. And also at the peak time in the morning and in the evening for the buses traveling through the Lushanhou area, and we will dispatch more buses. Make sure that the buses are actually dispatched in a reasonable manner. Make sure there's no big long queue waiting for the buses. And also passengers should be wait in line by keeping the social distancing. And also would like to call on everyone to protect yourself. Make sure that you wear masks and to show your household proactively, and also keep social distancing. Let's say if you show the symptoms such as a fever or coughing, please protect yourself, and also discouraged to take public transportation, and also please report yourself to the nearby fever clinics. So everyone should monitor your own health and also make sure that you protect yourself. So you are the one to take care of yourself. It's a Qingdao TV. So for the NAT test that can be conducted crossing community or the cross region, in order to speed up our work, yes, you can be tested in other regions or other districts. I believe that Mr. Zheng Huaqiang can give you more answers. As West Mayor Xue mentioned, that is a yes to your question. We talk about actually this is actually based on a permanent residence that we conducted the NAT stations, but actually it's also okay to be tested in the other districts, not your residential areas. And for the armies or the schools, because they had a larger number of people, they also can contact the local authorities. So we talk about we should follow that territorial management style, that if possible, that they can get their sample selected in their territory. It's also good for us to record their information and also cover all the residents in these districts or regions. Question to Vice Mayor Xue. This time, actually, Qingdao mobilized all resources to conduct a citywide NAT. Anything really deep in your mind this time? Thank you for your question. I believe the outbreak of coronavirus in Qingdao really make everyone nervous. But on the other hand, we also see very touching stories happened to encourage us moving forward. We talk about integration of the Jiaodong Peninsula, all the surrounding regions, that give us their helping hand to pair up with the different districts in Qingdao. They give us the NAT equipment and a dispatch team. So for the capability of NAT, we not only rely on the capabilities in Qingdao, because we need to finish everything in a really short time. So these surrounding cities also send the vehicles to transport samples to their cities to show the really deep brotherhood. We talk about the pairing city for the poverty alleviation is Longnan in Gansu province. Chengxian County actually is also the poverty alleviation paired up places in Gansu province. And we give assistance to these cities, the villages. So in a very short time this time, actually Chengxian County organized their medical personnel from the hospitals and also local CDC, in total 50 people by air arrived in Qingdao to support Chengyang district for NAT endeavors. So it's really touching stories. So we are not alone in this battle. And we also give the credit to the socialism characteristics. Thank you very much. The Hong Kong economic rate. So how many stations for NAT we have in Qingdao, and right now we release all the information. Mr. Zhao from Health Commission maybe can give you more information, but we still need to wait for another 2 days for the more information to be released. So far, we have 4,090 stations located in the different districts, the compound. And for the different districts, I also use a different social media platform to give the notice to their different compound blocks or villages. So we have 133 stations in the Chengnan area. So the media actually helped them to promote this message. So 130 stations available in the Shibei areas. So it's like they through the official account and to make the announcement. Licang have 288 stations. So they have utilized the WeChat official account to provide information. The Laoshan area, 330 stations. They also have their official website and apps release the information. For Xihan new area, they have 977 stations. So they have their official WeChat account and village commissions or DA block commissions to release information. 302 stations available in Chengyang and also release information in their local official accounts. For Jingmo area, 509 stations available there, and also utilize Jingmo district official account to release the location of each station. For Jiaozhou area, 442 stations. For NAT, they use 16 communities and to provide a hotline service. Qingdao, with 807 stations, used a message, WeChat, and also door-to-door to give the announcement to the residents. And Laixi area also utilize the written announcement to their citizens. So basically, you can tell different districts actually use different measures to make sure every resident in their region know the information. 7 evening. So my question regarding the sweeping NAT. So besides the cooperation made by the local residents, what other measures have you taken? So first of all, we should give a big appreciation to our friends of the media because you are the ones actually help us to promote these informations, how to get NAT, what are the requirements, and where is the place for NAT, actually all based on your coverage. So for these really large-scale NAT work, and as Mr. Xue introduced, the officials in each regions and districts actually has the leading role to drive the endeavor of NAT. And also the residents and citizens in Qingdao are actually very cooperative because everyone understands that this actually is you show a responsibility not only to themselves but also responsible to their family members, their friends, and also their colleagues. Actually, on site, we found that the residents they not reported themselves actively to the station. They also helped our people in the stations get NAT samples of the disabled or the elderly. And actually, the residents also actually send food to our people working in the station. And we also saw that online via Douyin that a very young girl as the medical personnel actually used the loudspeaker in the building and to call the residents not received NAT should right now come out to get tested. And also because the fewer people lined for the NAT, so she also helped to organize the elderly people to be tested in the evening. All these stories tell us that it's not really use the mandatory measures to force people to be tested. Actually, look at that this is a joint effort and people show their responsibility. And also, of course, a big thank you to our friends from the media. So with everyone pitched in, that we actually have these efforts made by everyone play their role. It's China Daily. So actually we registered the people's information in the written form, but actually this is a really large scale of people, how we make sure that the result is accurate. First of all, this is a sudden outbreak to us. As within a short time period, we should finish the NAT. So talk about the capability of NAT, actually that can reach 200,000. So which means that for the communities, the majority of them actually is in the low risk levels. So we talk about actually their samples can be mixed. So for the that should be follow the ratio of a 1 to 5, 1 versus 5, or the 1 to 10. So we say once we found that positive results, then we will get that 5 people to be tested again. For the close contacts and the close contact of close contacts, that they will be tested by their own sample. And this is also the requirement from the central interagency mechanism. And actually, they also ask each province should capable to do so. So as you mentioned, different regions and different districts actually have different practice. And some actually registered as their ID numbers, some actually scanned the QR code, some written in paper, but results more or less the same, just in different forms of registration. Let Mr. Guo to jump in, Mr. Zhao to jump in. So talk about the medical personnel in say collecting NAT samples. They first received the really strict trainings. So we also have a very strict process and conduct that need to be followed in terms of selection and test. So we talk about people should first fill in the form and then wait in the queue for testing. And also some actually use their ID code or just use a WeChat to scan the QR code for registrations. All these actually can make sure that the information of registration is correct, and also the information actually is in line with the final result. So there's no problem in this regard. So we will not really find that the samples with someone else's name. 210 people from other cities in Shandong province actually also help us to improve our capability of testing. So I also like to take this opportunity to say a big thank you to our colleagues from other places in Shandong province. Thank you very much. Due to the interest of time, this is end of the QA session regarding the updated information of disease prevention and control, and we'll have the press conference to give you the information. And also you can check our official website. And also please guide the public to follow the information released by the authorized website. So to win the battle against COVID-19 not only relies on the people across the lives, but also actually relied on the correct information. So I would like to say a big thank you and also pay a tribute to all our friends from the media. And you always can check our official website of the People's Government as well as the Municipal Health Commission. And this is the end of today's press conference. Thank you all for speakers and also thank friends from the media. Thank you all.